Hello friends, happy to meet you all in the third part of our ophthalmology for undergraduates and postgraduate beginners. Today the topic of interest is parts of a case presentation. Case presentation includes 5 parts. Without these 5 parts, the case presentation will be incomplete. Let us see what are those 5 parts. The first part is the history taking. The second one is the general examination that include examination of systems. The third part is local examination. As far as ophthalmology is concerned, it is examination of the eye and its adnexa. The fourth part is summarizing all the findings we obtained in history taking, general examination and local examination, and the final part is the diagnosis. Let us discuss about the history taking, that too the particulars of a patient or general informations of the patient today. General information of a patient is very important because it will help you in making a proper diagnosis. General information of a patient includes these 6 parts as far as ophthalmology is concerned. First thing is name of the patient. Second is the number of a patient. Third is the age of the patient. Fourth is the sex of the patient. Fifth is address of the patient. Sixth is occupation of the patient. Why name is important? Name helps you to identify a patient. Name makes the patient comfortable when you call them by their particular name. They feel intimate to you and they will be comfortable throughout the period of the treatment. They are going to get it from you. Second is the number of the patient. As our country is hugely populated, too many people are having a similar name. To identify them particularly, we can either use a separate outpatient number or an inpatient number, or you can use the Aadhaar number itself to identify them correctly. The third one is age of the patient. Certain diseases are very common in certain age groups. Senile cataract, that is cataract occurring due to aging, occurs in people who are after the 5th decade of life. And another example is retinoblastoma, that is cancer of the eye that affects only small children up to 5 years of age. The fourth one is the sex of the patient. Sex of the patient is very important because certain diseases are common in males, certain diseases are common in females. For example, open angle glaucomas are very common in male patients because of bigger eyes. In females, closed angle glaucomas are very common because of the small eyes. Next, coming to the address of the patient or the locality in which the patient lives. The patient, I want to tell an information, we have a pond in our area. Whoever goes there and takes bath in it, they are prone to get aspergillosis. That particular area is endemic for aspergillus infection because of the people taking bath in that pond. I have seen so many cases of aspergillosis in those patients' conjunctiva and nasal side also. The sixth one is the occupation of the patient. Occupation is going to expose the patient to certain hazards. In our area, agricultural work is very common. People stand under the sun for so many hours in a day for doing their work. They are constantly exposed to the ultraviolet rays. They are constantly exposed to the dust particles in the atmosphere. They are very prone for getting pterygium in their eyes. They are very prone for getting nuclear cataract in their eyes. These are some of the examples for occupation of the patient. So, general information is very important. General information might help you in a large way in getting a proper diagnosis. Thank you. We will see in the next video soon.